Definitely thanks to the organizers for calling us and inviting us at the same time. So what we are talking about accreditation in the last 20 years in the country, in every journey what we went through from 2005 till date, I as a clinician and as also looking at as a medical administrator, plus as a quality man, in the room preparing the unit for accreditation and sustaining on quality and patient safety, literally looking at how can we enhance the patient safety net. So what we all can do to decrease a code blues or an event in the floor. How can we build we are all talking there are systems are coming across, there's accreditation bodies there, they're helping us, training is reinforcement, lot of resources churning is happening around. But still every time when we are going through an event is happening, we were always worried about what we can do, how we can overcome that. Any IT conferences we used to join, they used to talk too much about it, but none of the products were able to be used by us and applied as a part of an applied science. So this is what we all know. We know about patient monitoring system. We all know that every hourly, every fourth hourly, every sixth hourly, every continuous monitoring, recording once in an hour, all that part of the story we are doing it mainly to what I said, to prevent those events happening on the floor. Finally in the last few years we are started seeing some tools were coming across. Something is really good, something is doable, implementable, executable, but is it going to happen in our setting? So these are the challenges each one of us, as I said, how can we come across with some solution which is really effective, going to help us out. It improves our quality of care. As we keep telling we are in the business of care. When we are in the business of care, are we doing 100% of the time? Is there any compromise? Thing is, none of us, yes, everyone wants to own the problem, own it and overcome it, but it's all right. But thing is, are we really doing it? So in that way, when we are looking at what is the ideal solution, so how we can do something to reduce the burden on the nurses, but at the same time, how can we handle our nurses, wherein they get right clinical right inputs at every time. So these are the lot of solutions that recently come into the country. In that, one of these solutions, what we were thinking, and when we were deliberating on which one to apply what and all those things, all these 6 points which comes across is, yes, is it affordable? Is it easy to adopt? Is it easy to use? Can it be scalable? At the same time, is it robust enough, validated? I don't want to have any errors in the system, can it be used in the future? So with all these deliberations happened, the solutions are available in the country as of now, and I want to tell, this is what we have used one of the solution, and particularly our hospital in this particular thing, we are getting all the parameters from heart rate to ECG rhythm to saturation to blood pressure, to respiratory rate, whether it is tachycardia, tachypnea, or a patient see whether is on oxygen, off oxygen, invasive, non-invasive, literally we can monitor the patient, and it literally reduces the nursing time. Nurses can spend more time in providing empathetic care to the patient. At the same time, once you take the patient on board and put them with the vitals, recording everything, then you will be continuously monitoring these patients. Systems are built in with alerts. This is what what we did at our hospital. Today the Jayanagar, Apollo Jayanagar hospital is a 140-bed hospital. All 140 beds are continuously monitored. We can proudly say that it's a smart hospital, wherein 35 ICU beds, of course your recovery beds and ER beds are all continuously monitored and have, but however, every bed is continuously monitored with Dozee at this point of time. We also have other things depending upon the need of the patients. We'll definitely use those. So what we all did, how we are using this thing in mitigating the risk. One part of data is coming across, the variances, the subtle changes, what's happening with the patients, which are all been continuously monitored At the same time, like, when my nurse might be busy, like, she might be seeing another patient, but are we going to miss a critical alert? So we have this critical alert or a command center wherein, like, people are sitting there. Of course, the alarm system is there. When we keep on building layer over layer to make sure that, like, zero events happen, when the aim and the aspiration is like that in healthcare, quality is nothing called as 0.5, either it is yes or no, right? So keeping that in mind, we definitely need to have the command center or people sitting there be vigilant only to monitor these things. Instead of doing it for every bed, they're doing it for all the beds in the hospital. So that is the command center what we have, and which is integrated with our med mantra. Of course, the part of the journey, like, what's happened in the last 90 days to any change management, one has to go through. We will go through the same story. Real true game changer for us, the leadership. How can we think that, like, every bed in the hospital will be monitored? And next thing is, how can we, like, make my frontline staff align with the same vision what we are having? Same, like, top-down approach and bottom-up approach is the literal real principle which has helped us out. Of course, like, champions like our nursing team, the team leaders, the in charges, understanding what the ethos of the patient safety and quality and safety we are talking about, literally walk the talk. They made it happen today. Every event on the patient bedside is been able to be captured. Of course, like, as we keep recording the events, it can be like, now these alerts are also going towards the event recording, like incident reporting. So when you keep recording that, the accountability will further going to increase. When there is a more accountability, certainly, like, what we are looking at, that's going to happen. Either in the mortality meeting or your code to review committee or in your incident analysis, in any of these 3 or 4 things will definitely come up. Nothing will be brushed under the carpet. System is very vigilant in that. Of course, training is another thing. We have come across with IT infrastructural issues as usual, right? So we'll get 101 reasons to get not to adopt any technology or this thing. But at the same time, who can make the difference is, yes, you give the resource. Yes, internet is not there in every room. Yes, provide that. So thing is, signals are weak, like, augment it. End of the day, this need to be done. That is the commitment level coming from the leadership. And today, we are, like, what results we are having. 0 code blues happened on the floor in the last 90 days. Of course, we mobilized the patient and shifted the patient into the ICU. Definitely, it will going to help and increases the patient satisfaction. Ultimately, it's going to improve the outcome. As if we are not be part of this change, like, what we all dreamt in the last 20 years of accreditation journey is all about, like, how to enhance the safety net. Yes, we all want to keep our patients safe. At the same time, all of us want to keep, like, I would say, how can we build a reliable system around to keep the patient safe? At the same time, like, how we can enhance the safety net for every patient, every touch point, every contacts what we have in the hospitals. At the same time, the culture of the organization is equally important. We need to bring that culture of just culture. Thank you so much.
Thank you, Dr. Govindaiah Yatheesh. It's a wonderful presentation, and it is new for majority of us. And I would like to ask how it is affordable, and number 2, whether it fails sometimes, and what is the downtime?
Okay, I missed a couple of things. One is, like, how can we make it affordable, right? So when every patient is started using the scale of use, like, today all my beds have been either with one of the other monitoring system. Yes, Dozee is there, her bed, Dozee bed is the theme what the guys are talking about. But we look at, like, at Apollo, we look at, we want to provide everything as a neutral platform and make it, like, yes, today the affordability is it's not in, like, like equally like in ICU monitoring charges. If you are there in the ICU monitoring, will be like, having about 7,000 to 8,000 rupees or up to 10,000 rupees will be the charges in the ICU monitoring, depending upon the criticality of the patients. Whereas on the floors, monitoring may not be the same cost. It is 1/10 the cost of that, even less than that is what I want to say.